FINA is a clinical trial treating advanced or metastatic ER-positive, HER2-negative breast cancer with a drug called ipatasertib and fulvestrant. This study is being conducted by the researchers of Breast Cancer Trials, who conduct clinical trials research throughout Australia and New Zealand to develop better ways of preventing, diagnosing and treating breast cancer. Breast Cancer Trials is working with the Canadian Cancer Trials Group on this trial.
You have been invited to take part in FINA because you have advanced or metastatic ER-positive, HER2-negative breast cancer that has grown or spread despite earlier treatment. You have been treated with a CDK4/6 inhibitor such as ribociclib, palbociclib or abemaciclib. You have also been treated with an aromatase inhibitor such as letrozole, anastrozole or exemestane. The information in this video briefly explains the study and what happens if you decide to take part. More detailed information is available in a written information sheet which will be given to you or emailed to you by the study team where you are being treated.
It is important that you take as much time as you need to decide about taking part in this study. Talk to your family, whenua, friends and/or a family doctor about taking part. Feel free to ask any questions at any time. All research is voluntary. You don't have to take part if you don't want to. If you decide that this study is not right for you, you will continue to receive the best possible care for your breast cancer. If you do decide to take part in the study, you can leave at any time and this will not affect your care in any way. Just let the study team know as soon as possible.
If you want to take part in the study, you will need to review the information about the study, meet to talk to the study team and ask any questions you might have to make sure you understand what you are agreeing to do in the study. Sign the consent form, which will be available online or can be signed on a paper form.
Fulvestrant is commonly used to treat advanced or metastatic ER-positive, HER2-negative breast cancer. We want to find out if the cancer remained under control for longer in patients treated with a drug called ipatasertib with fulvestrant compared to with fulvestrant treatment on its own. Endocrine or hormone treatments with CDK4/6 inhibitors are effective in treating ER-positive, HER2-negative breast cancers, but in advanced breast cancer, the cancer eventually grows or spreads despite the initial endocrine treatment. So other treatments are needed for these resistant cancers.
All living cells, including tumours, have functions that make them develop, grow, survive and die. The PI3K/AKT/mTOR pathway within cells is important for cell growth and survival, and it may cause some ER-positive cancers to become resistant to endocrine treatments. The drug ipatasertib can prevent the growth of cancer cells by blocking this pathway. Medications must be approved for use by the government. Ipatasertib needs to be tested in clinical trials before it can be approved by the government to be used for treating breast cancer in routine care. Fulvestrant is approved in Australia and New Zealand to treat ER-positive advanced breast cancer. FINA is a randomised, double-blind, placebo-controlled study. This means randomised. You will be placed in one of two study groups. This will be decided by a randomisation process, meaning you will have a 1 in 2 or 50% chance, like flipping a coin, of getting put into one group or the other. Neither you nor your study doctor can choose which group you will be in. Arm A is treatment with ipatasertib tablets and fulvestrant injections. Arm B is treatment with placebo tablets and fulvestrant injections. Double blind. Neither you nor your study doctor will know which medication you are receiving, although you can find out if needed for your care. Placebo-controlled. A placebo is a medication with no active ingredients. It looks like the real thing, but is not. Treatment on this study involves having cycles of treatment. In this study, a cycle is 28 days. Taking a tablet, either ipatasertib or placebo, for 21 days out of 28 days. You will be given a diary to record when you take your tablets. Having a fulvestrant injection into the muscle of each buttock on days 1 and 15 of cycle 1, day 1 of cycle 2, and then every 28 days. If you are a woman who is premenopausal, you will have a gaserelin implant injected under the skin to stop the production of the hormone estrogen to help study treatment work. The implant dissolves over time, so you will need to have this every 28 days. Taking a tablet for the first 28 days to help prevent diarrhea, a known side effect of the drugs used in this study. You may need to continue taking this tablet if necessary. Both men and women are strongly advised to avoid pregnancy during the study and for up to 2 years after your last dose of study treatment. Your study doctor will discuss this with you. You will continue taking study treatment until the drugs are no longer effective against the cancer or side effects from the study treatment make it too difficult to continue.
If you decide to take part, you'll be asked to sign and date a consent form before starting any of the study procedures. You will have visits. Before you start study treatment, on day 1 and day 15 of cycle 1, on day 1 of every following cycle during study treatment, that is, every 28 days, 4 weeks after you stop study treatment, and then every 12 weeks after that.
You will have the following procedures. Before you start in the study, you will need a tumour sample to look at any indicators or biomarkers in the cancer, preferably from a new biopsy or from an earlier sample, for example, where the cancer was first diagnosed. Medical history includes your current health, cancer diagnosis, previous treatment, and other important conditions. General physical examination, including height and weight. Review of current medications, including over-the-counter medications, vitamins and herbal remedies. Your doctor will let you know which medications you can keep taking and which you will have to stop. Blood samples. The blood sample taken before the study will be sent to the USA to see if your cancer has certain indicators. This information will be used when researchers look at the study results and see if these indicators predict how the breast cancer responds to treatment. Routine blood samples during study treatment to check organ function and a pregnancy test if you are able to become pregnant. Scans may include computed tomography or CT scans, bone scans, or magnetic resonance imaging or MRI as necessary. Photographs of the cancer, if it spreads to your skin, will be taken. Identifying features will be hidden. An electrocardiogram or ECG takes less than 5 minutes and checks your heart's activity and rhythm. Routine examinations and tests will be handled as if you are receiving standard treatment. You will be given a diary to write down when you take your tablets each day. You need to bring your pill containers to each visit. cfDNA is cell-free DNA, which is DNA circulating freely in the blood. cfDNA comes mostly from the normal cells in the body, but may also be DNA from tumours. On day 15 of cycle 1, you will have your blood sample taken before you have your tablet. Another blood sample will be taken 2 to 4 hours after you have your tablet. Questionnaires are completed at the clinic and take about 10 minutes. They will help researchers understand how treatment impacts different areas of your life. We will also ask you to consent to your tumour and blood samples and any photos or scans being kept for later research, not related to the final study. This is optional and you will be given a separate information and consent form.
You will have some extra visits with your doctor and more injections and blood tests than routine care. Medical treatment often causes side effects. Side effects described as most likely are estimated to occur in more than 20 out of every 100 people treated. The most likely side effects of ipatasertib are nausea, vomiting, diarrhea, tiredness, feeling weak or having no energy, increased sugar level in the blood. Further information about other less likely and rare side effects of ipatasertib are included in the written information sheet. The side effects of fulvestrant are well known and your study doctor will discuss them with you.
We will protect your privacy and have systems in place to ensure that your information is kept confidential. You will not be identified by name. Instead, a participant code will be used on all study documentation. Other people who look at study data and study quality may see your study information, like the study sponsors, relevant authorities, or as required by law. We may share your study information with other researchers in the future.
The written information sheet includes the details of people at your hospital who can be contacted if you have a complaint or concern. If you suffer any injuries or complications as a result of the study, please contact the study team as soon as possible to arrange appropriate medical treatment. Breast Cancer Trials, as a sponsor for this study in Australia and New Zealand, holds appropriate insurance.
This video is a summary of the finer clinical trial. Please discuss the trial further with your study team. They will be able to answer any questions you have. Further details are available in the information sheet that will be emailed or provided to you by your study team.